Hello, everyone. Welcome back. Welcome back to this session, and a very good evening. And also a happy New Year. Uh, right now, we will have our AHIN Country Dialogue session, Part 1. This session aims to share lessons learned from Asia in implementing digital health response to COVID-19. Tonight, we have with us a lineup of health experts from various countries of the Western Pacific region sharing their perspective. And to all our panelists, thank you for joining this session. From Cambodia, we have Dr. Him Panari, the National Consultant for the Health Strategic Plan of 2016-2020 Cambodia. From Hong Kong, we have Mr. Klube Ng, Chief Executive Officer of eHealth Research Institute of Hong Kong. From Laos PDR, we have Dr. Chansley, the Deputy Director of Planning for Ministry of Health Laos PDR. From Malaysia, we have Dr. Faisal Izwan, who is a consultant public health physician from the Disease Control Division of Ministry of Health Malaysia. From Mongolia, we have Dr. Anbol Sirinan, Project Coordinator of eHealth Project for the World Bank of Ministry of Health Mongolia. And from Philippines, Dr. Enric Tayak, the Director of IV Knowledge Management and IT of the Department Health of Philippines, and also the chair for ASEAN eHealth Technical Working Group. So today, we are going to listen to all our panelists who will share with us the lessons learned during the COVID-19. So to begin with, I would like to invite all our panelists to give us a 1 to 2 minutes to share with us how COVID-19 pandemic has affected the national health system. So with that, we'll start with Dr. Him. Please go ahead. Dr. Him, to you.
Yes, good evening, everybody. Here, I am him from Cambodia. As you already know that we are in the crisis situation in all the region. Cambodia is also one of that. So in this period, in this time right now, it is a crisis that Cambodian is, it seemed to be a little bit less heavy. By now, we had detected infected cases around 300 to 400 cases detected. Nevertheless, we still do not have yet any case deaths up to now. Today, this week, Cambodian government had already opened public school and public gathering in the small size, a small group. Nevertheless, we still keep very caution, very strict on the measure of prevention, keep distancing, hand hygiene, so on and so forth. So that's our situation.
Thank you, Dr. Him. Klube, you want to share with us?
Good evening, everyone. Yeah, this is Kobe from Hong Kong. The COVID-19 actually attacked Hong Kong quite much since last year, and we have now about 10,000 cases and less than 200 cases up to now. And also the COVID-19 also make a quite serious loading to our health system. Especially we have less than 50 hospitals, and we don't have enough beds actually. So we need to build a new beds and also to arrange some hotels for some tests, and also to have some new beds built temporarily. But luckily, we have some built digital health systems, such as we allow the private doctor to report the case through the digital system to the government. So we can handle it quite well, but we also had to face many challenges, especially the many waves will come this year. So we hope that we can collaborate with other countries and regions to work together to make the vaccine management and also to share the information. Yeah.
Oh, thanks, Klube. Looks like many of us are having a similar problem. So now let's hear from Laos PDR, Dr. Chansley.
Thank you, Fasila and everyone. So for now, we have very few cases. The total only 41 cases, and so far now we have only one patient stay in the hospital, and the rest already cured. So, however, this is also affect to the health system. First, talking about the human resource. So all the staff has to be trained and repurposed to manage the COVID-19 pandemic. Also, we have also health service delivery also had to be reoriented to facilitate the outbreak of the COVID-19, meaning that all hospitals need to be give space for the quarantine, for the contact tracing and managing activity. We have also effect to the government and also the health also financing. So many activity has had to be shifting the budget to focus on the COVID-19 to purchase equipment and also all the drug everything. So in terms of health information system, we also have to be further strengthening and enhance providing information so that we can have also affect to the health system resources. Uh, Also, in terms of logistic management information system, the system also need to be adapted. We need to create more robust system so that we can track any equipment or drug that deficit in the health facility in the all provinces. So this is experience from Laos. I just like to say to do that.
Thanks. Thank you, Dr. Chancellor. Next, we go to Malaysia, Dr. Faisal.
Thank you, Dr. Vizila. So good morning, everybody. Right now, Malaysia is facing the third wave of the COVID-19 pandemic, which is quite bad. Cumulatively, we have about nearly 130,000 cumulative cases, with about 25,000 patients who are categorized as active. That means they are warded either in our hospitals or in our quarantine centers. So you can imagine the number of beds these patients are taking up. Out of these cumulative cases, we have about 521 deaths only. So that works out to only about 0.4%, which is thankfully quite low. I suppose when we talk about the context where COVID-19 is affecting our healthcare system, I would categorize it as the response itself to the COVID-19 infection. That means the resources required for the prevention activities, for early detection, for contact tracing, for isolation, and also for treatment. We must also consider the consequences of the movement restrictions that come together with COVID-19, the economic injury causing mental stress among our population, and other negative consequences of isolation, not just mental, talking about violence, intimate partner violence, and unintended injuries as well. The other consequences that we need to consider when it comes to the health system is disruption of usual services that we deliver for health promotion, for vaccination, for early detection and screening activities, for NCDs, for cancer, for various other conditions, for primary care, for chronic patients, for secondary care, for patients that need treatment in hospitals. And I think a lot of people forget about rehabilitation and palliative care component, especially for chronic diseases. So this, spans the whole continuum for disease prevention and control. So don't forget about the disruption to the usual care services. I'll stop there first, Dr. Fazilah, back to you.
That's interesting, Faisal. We'll come back to that, especially to address NCDs and other conditions that is non-COVID. Now, next to Mongolia, Dr. Engbo.
Thank you, Fazila. Good evening, everyone. I'm Engbo from Mongolia. Mongolia was one of the few countries that has taken rigorous measures since January 2020 in terms of prevention and containment of the COVID-19 outbreak. However, beginning of the November 2020, local transmission has been registered. As of today, Mongolia has 1,362 cases and 1 death. 400 of them confirmed as transported cases and around 900 confirmed as local transmission. All cluster infections have been registered in UBCT and 6 provinces. Government is taking pandemic response action based on assessment of COVID-19 situation constantly. For example, from 23 December 2020 until 11th January 2021, there's a strict lockdown is being implemented in capital city. Authorities urge to the public to stay at home and restrict their movement only the essential necessities such as to buy groceries and medicines. In Mongolia, frontline workers, especially healthcare workers, are most vulnerable to the COVID-19. In total, 90 cases are healthcare workers in Mongolia. At the moment, hospitals are also most risky place for all visitors and workers. 4 specific clusters of COVID-19 are directly correlated with the hospital. And the situation in Mongolia is like that. Thank you.
Thank you, Dr. Embold. I know many countries in the world are already facing massive local transmission and also healthcare workers. So now let's listen to Philippines, Dr. Eritaya.
Thank you, Dr. Fazila. Good evening, everyone. The Philippines remain one of the most affected countries, not only in the region, but also in the world. Right now, we have over 480,000 cases reported and over 9,300 deaths. It was very clear from the start that our goal was to save as many lives as we can, as we opted to flatten the curve so that we can also recover economically. And to do that, we had to mitigate the impact on what has happened to our health system. There was widespread disruption. But even with the disruption, we managed to make sure that local government units are able to carry out public health programs despite community quarantines in many areas. Now we saw the introduction of digital solutions aimed at improving access to health services that allow us to make sure that we are able to detect cases very early, test them, quarantine those exposed, and isolate, doing contact tracing and treatment. But of course, it was very important for us to protect our frontliners. And of course, regarding digital solutions, we're able to introduce artificial intelligence, predictive modeling, and telemedicine. Thank you, Dr. Fazila.
Oh, thank you, Dr. Eritaya. So actually, I think we're hearing from everyone, we have realized that the COVID-19 pandemic actually made us realize that digital health is digital intervention is a very critical component in this pandemic. So I would like to go on and ask for the next question will be, how did you leverage the use of ICT in this pandemic? So I think I will pass to Klube from Hong Kong. Perhaps you can share with us, how did you leverage the use of ICT?
Okay, thank you, Dr. Fasila. I think Hong Kong, like other countries and regions, we have adopted the ICT to develop mobile apps to handle the check and trace of the COVID-19. And so we are working with the to add the new features, like use the iBeacon, the Bluetooth in the bus, in the shopping mall, to automatically detect whether the citizen to go to take the bus, take the MTR, the railway, and also to enter some cafe. So it's more convenient for the citizen no need to scan the QR code to record their transit in the community. And also, on the other hand, some NGO in Hong Kong, we also leverage the ICT to enhance the booking system and also deliver the drugs to the citizen, to the patient, because you know that last year we need to some restriction for the social distance, so it's not convenient to let the patient to go to the hospital to take the drugs. So we have to provide the service to deliver the drugs to the household instead of let them to go into the hospital. I think the ICT is quite good to enhance the convenience and to reduce the risk of getting the COVID-19. But in the future, the government also to arrange the booking system for the vaccination. I think it's more convenient to let the patient to choose when and what type of the vaccine they need to make the injection for them. I think other countries in Asia, I believe that we will also can do this similar arrangement to use the ICT to adjust the COVID-19.
Ruby, if I understand you, you are using Bluetooth in terms of contact tracing. Am I right?
Yes, right.
What about patients what about people who are quarantined? Is there any tools used to monitor them at home?
Actually, at home that we ask the citizen to volunteer to actively to report their cases. We do not to compulsory to ask them to report their situation, but we request those high risk citizens of some buildings. For example, if we have 1 or 2 cases in the same building, we will do the quarantine for the whole building and ask the whole building occupants to do the test for the COVID-19. And also for some immigration, we will ask the people when going to Hong Kong, we will ask them to wear the hand ring, the wrist. So also we will request them to connect to the mobile app to report the trace of where they go, and we will ask them to stay in the household or in the specific hotel.
Oh, great. Thanks, Klube. Perhaps the same questions I would like to ask Dr. Chansley. How are you leveraging ICT, Dr. Chansley?
Yeah, thank you, Fasila. So for the Lao, we already have existing health information system using DHS2. We just turn it into the COVID-19 module so that we can because every health facility, they already used to use DHS2. So we just add one module for the COVID-19 and people get the data so that we can see the cases. And secondly, we also support with the WHO. We also use the tablet. We develop the app and put in tablet. And this tablet we put in every provincial hospital so that every day the nurses, they can press the button to inform the central level because it's synchronized to this too. We can see how many nurses, how many beds in the hospital that how many lack of things. Every hospital, every day we just tracking. And also we have in the system in lab we have also the supply system. Supply system also they also further develop within into a dashboard so that the whole country we will know where every warehouse in the country we will know every province with what kind of equipment will lack of, what kind of everything. We can immediately inform the EOC committee in the central level. This is ICT that we use during the outbreak. Thank you.
So what about, do you use anything for contact tracing? For the people, is there any mobile app or any form of tracing that is done?
No, we don't have this one, but we we don't have this one. But anyway, because of the country, we are just we locked out it. Every places so that we can have we can monitor everyone coming to Laos. We also know.
Yeah. I think you did a very early lockdown, so that really helped to protect the country. Before I go to the next question, anyone wants to add about how they leverage ICT? Anyone like to add? Yes, Faisal, go ahead. Yes, okay.
I suppose the digital solutions are already there. They are already in existence, and I'm referring to more on the primary care, delivery of primary care for chronic disease patients. Telehealth, appointment systems, systems for delivery of drugs to patients' home. These are not new solutions. What COVID-19 has enabled is, force people to consider the solutions where they wouldn't cause for certain challenges that we can discuss later.
Yeah.
And the other thing I would like to highlight about Malaysia's My Sejahtera application. I hope some of you would have heard of it. This is a national application which is used to, in a way, to monitor movements of the population. So, at the last check, I can't remember, it was a month ago, over 24 million Malaysians have already downloaded the app. And you imagine the population of Malaysia is only about 34 million.
Yeah.
So basically almost all adults have downloaded the app. So notwithstanding the use of the app, I just would like to highlight that COVID-19 made it possible for something which I didn't think was possible to actually force. Well, it wasn't regulatory, you didn't have to download it, but people felt it was something that made life easier to move around with the app. Back to you, Dr. Fazila.
Okay, great, thanks. And Dr. Engpo, you wanted to share something? Yes, go ahead.
Thank you, Fazila. I just only add one thing there for the contact tracing. We are using QR code for contact tracing. And actually, now the all population is using the mobile phone.
Yeah.
We have application in when the patient or people go to shop, and then you then usually read this QR code, and then we are using this QR code for contact tracing. Thank you.
Yes, Dr. Eric, perhaps you would like to add something. What's happening?
Oh, yes, Dr. Fazila, we have a combination of technologies for contact tracing. We started with manual contact tracing applications, and this has been uploaded from more than a million in the population already. And we are working with Google and Apple for exposure notification. This is a digital contact tracing, and we hope to supplement our manual contact tracing in the next few weeks. This is very exciting for us because this is a demonstration of how government can work it out with the big industry partners like Google and Apple. Thanks.
Oh, that's great. Dr. Him, would you like to add something on what's happening in Cambodia?
Yes, of course, Cambodia have already existing system in using in our health system to what we call the zero reporting system, which is already used since long time ago. In this occasion, in this COVID-19, we had been integrated into this system, and also the alert system from mobile phone to inform to people and to get contact to people. Nevertheless, we still do not have contract tracing yet. Mainly, we trace people through our network of local authority, which are reporting that people in the area, in the community. Going to this ICT system, we not yet apply it. We just integrate this module into our system of zero reporting system.
Okay. All right, great. Thank you, Dr. Him. I think we'll since we have already heard some of the digital intervention, I think I would like to focus. What are the challenges you are facing in implementing this digital? Perhaps we'll start with Faisal.
All right. A lot of times people talk about the technology itself, about the engineering. So I think I would like to highlight 3 challenges. Earlier on, when Alvin was speaking in the earlier session, he was talking about people being in the same boat. I think for COVID-19, we are all facing the same storm, but we are in different boats. People with NCDs, older adults, lower socioeconomic class, in Malaysia, the migrants, people in prisons, they are more susceptible unfortunately, the older adults, the lower socioeconomic class, are least likely to engage with digital solutions.
Yeah.
So you have all the nice tools,
Yeah.
but they don't engage because of either low health literacy, low digital literacy, and of course issues about access to the to internet. Even in cities, devices, how much are you paying for your broadband access? So that is one. And even if you have a tool, I use the word tool, right? Digital tool. These are developed by experts, perhaps parachuted from other countries, perhaps. You don't have that local context. You're not co-creating that solution, and this is particularly relevant to the work that I do in non-communicable diseases, but changing behaviors. It's very difficult to change behavior when your solution doesn't involve the people you're trying to engage, to change. So just to summarize, the interface between the digital solution and the human. And this applies also to healthcare provider, when you look at them in primary care, whether the tool suits the way they work. So they're human. The other aspect I would like to highlight here is of course, everybody talks about this, the regulatory environment in your country, how ready it is to adopt digital solutions. And lastly, there are many aspects, but I just like to highlight the three. Lastly, evaluation. We are very poor at this in this part of the world. We like to do all sorts of pilots. We run all sorts of things, but there isn't any evaluation. We need to learn. We need to learn from our experience, even if it didn't work, particularly if it didn't work, because that will be valuable to share among us so that we don't repeat the same mistakes. Unfortunately, a lot of the data publications right now when it comes to COVID-19 and digital solutions around COVID-19 are all coming from developed nations. So that requires investment. It's not something that you can do on the side. It's not on the side. It's something that you have to plan, that has to be resourced. So for development partners out there, I think the emphasis on evaluating whatever solutions within the local context will be something that we need to think about and put extra emphasis. I'll stop there first, Dr. Fazila. Thank you.
That's fantastic, Faisal, for bringing up that point. Perhaps Dr. Engbo can also add further on the challenges.
Thank you, Fazila. I'd like to also emphasize maybe three challenges still. Because of COVID-related lockdown, now, all training is now shifting to online mode. And unfortunately, not sufficient ICT skills in some health professionals at all level of healthcare organizations. This is one of the challenges. And now the Minister of Health is conducting training through online mode, but some of rural areas, hospitals couldn't connect to the internet. This is the one challenge. Second one is this related to these post issues. This is the not sufficient budget for increase of internet speed and Wi-Fi and everything. And maybe I think 2012 also it's the same as other countries, and we need to increase our budget for IT items. Third is I think also we need to secure the patient information security and safety. This is also important because now all journalists is seeking the information about the patient and who, and when some cluster is detected in other areas, and they are also always asking in this patient information. And this is also the big challenge for us. Okay. Thank you.
Thank you. So I think we have heard about challenges, talking about people, social behavior, regulatory challenges, accessibility is also some of it, and also funding. So perhaps I will get the next question to Dr. Eric. What do you think are the lessons learned that I think that you could share for us to move forward in this coming years?
Okay, Dr. Fasila. Early in the days of the COVID-19 pandemic, we had to respond to the demand of the public from getting information from us. That's why we had to settle and establish a specific hotline, the 1555 number. And we didn't think it would give more benefits because telemedicine happened just instantly when we were planning for many years how we can actually establish and create platforms for telemedicine. And suddenly during the COVID-19 pandemic, we were able to do this. So one of the lessons we learned is that we had to really move fast and make sure that we work with worthy partners so that we were able to share resources and we monitored the results, our performance, so that we can make improvements as soon as possible. And there were third-party developers who approach us, and we had to make sure we evaluate them with the Department of Information Communication Technology. It became a whole team working towards a united purpose. And one of the lessons I learned is that you just cannot stop thinking about new things, even if you are pushed against a wall. Thank you, Dr. Fasila.
Oh, thank you, thank you. And what about Dr. Him? What do you think the lessons learned?
Of course, digitalization is moving toward nowadays. Nevertheless, to get the people moving with this movement, I think the main challenge is how to get people to change their behavior. So behavior change is not an easy thing. Of course, together with that, knowledge is also one of the main constraints. Thus, I think to our situation to reflect the reality right now, digital tool is there's available. There's plenty. But to get people to apply all of this, you need the motivation. You need getting people to change the behavior. Sometimes you need the regulation or regulatory enforcement, and also, of course, you need the budget to support. Yeah. But more importantly, I think education should play a main role, especially I would imagine that the government should incorporate this concept of this kind of domain ICT from the very early school age.
Yeah.
That maybe for the future it can move faster.
Yeah, thank you. Yes, Dr. Him, there's so much to learn from this last 1 year, which I think we will use to further redesign healthcare and also revive the economy. So perhaps Dr. Chansley, you would like to say something about the lessons learned?
Because according to the previous question about the challenging, one of the challenging is coordination, because we know that this is emergency, but we need to change the whole system, because when emergency happen, when we request, people still not thinking it's emergency. We have to go to many steps to submit authorization to the Ministry of Finance, but people still thinking it need to be go to, instead of you need to really fast procurement, other thing, the staffing, the transportation should be channel everything. It's not related to ICT, but anyway, we have to change the system. People talking about the new normal, but some people didn't quite understand what is new normal mean. We have to adapt to the situation. This is I think challenging and also experience we have to learn. Thank you.
Great, thank you. It'll be interesting. I think for 2021, the entire topic is going to be on vaccine. And I think all the countries are preparing either to receive the vaccine, but some have already started vaccination. So if anyone could share with us, how are you preparing to handle this vaccine, from the supply to handling it, to distribution, to getting it to the people out there? What are your plans in this thing, and especially in using digital health to help in the vaccine? Anyone can start? Yes. Anyone would like to start first? Perhaps Dr. Eric?
Oh, yes, Dr. Fasila. Right now, the government is keen on making sure that when the vaccine is properly deployed in the next few months, if and when they get the emergency use authorization, that even the digital solutions will be needed because we had to make sure we had to master list every eligible individual from priority areas that we're able to make sure that they get the first and second doses. We're able to monitor adverse events following immunization. So this is the next step in our digital transformation when we move into the vaccine deployment, which will occupy us very, very much in the next few months, Dr. Fasila.
Yeah. You were mentioning you were playing, you were partnering with big partners, big industry players. So are you also looking into vaccine, digital solutions for vaccine with the big industry players?
That's correct. In fact, what's nice about this is that they're approaching us with their solutions right now, and we are considering aligning them with our plans so that we can work on this together. Thank you.
Oh, great. Klube, Hong Kong, how is Hong Kong preparing? Klube?
Okay. Hong Kong government have already placed the order for few thousand vaccine, over 20,000 vaccines, like from the Oxford one, the China one, and also from the US one, and the BioNTech. And we have also developing the front end, the system to book, let the citizen to book the vaccination by booking. But for the back end, I think that we will use the system for the different health center to arrange the vaccination. Because in Hong Kong, we have many health centers in different districts, and they have already have some assistance system for the vaccination. So Hong Kong is quite good for using existing ICT tools to arrange the vaccination. But of course, you know that for some vaccination, we need a much low temperature for the vaccination. I think this is quite challenge for all countries. I think that we need, like Hong Kong, we need a special system to develop for those quite low temperature vaccine.
Yeah, handling the cold chain and actually the entire deployment of vaccine. I think you really need some form of tracking and a digital solution to it.
Yes.
Dr. Engbol, you have anything about on vaccine?
Actually, the Mongolia is now incorporated this COVAX program, which will be cover out the 20% of population.
Okay.
And additionally, we are seeking another way to get vaccine from the manufacturers, and we are actually developing this vaccine deployment plan, strategy and plan, and at least 60% of population we are planning to vaccinate, and hopefully the first quarter of the 2021 we will trying to get this 20% of population's vaccination.
So you'll be using some form of digital solution then to monitor.
Of course, we also is working closely with World Bank to get some fund from, and one part of this project will be the digital solution
for the vaccine. All right, great. Dr. Him, Cambodia.
Yes, of course, in Cambodia, we've been working closely with UNICEF. UNICEF has been supported our existing national immunization program. And of course, the COVID-19 vaccine, we are thinking to get through this system of a national immunization program. Currently, we are managing the beneficiary registration. So we have developed a digital tool for volunteer to register the priority beneficiary, the priority group, in order to receive the vaccine. And then in terms of logistics system, we've been planning integrated to the existing system of national immunization program. We also plan to build application, mobile application, in order to monitor all vaccine beneficiary and processing and then logistics. That's this our action.
Great.
Yeah.
Perhaps a question for Faisal. Faisal, other than vaccine, you think there's any solutions or out there that the countries can share among the regions? Because right now it looks like everyone is doing their own things. What is your thinking of that, Faisal?
Vaccine itself, I mean, we cannot run away from the politics of it. In Malaysia, we are purchasing from several countries. You know, you're not hedging into one country only or one supply source only, and a lot of discussions is still very much internal. So it's not something that's easy for us to share in the public domain. Even the policy for who should get it first is something that we need to discuss in the country. You know, yeah, I wish as a doctor we can say everything is evidence based. Unfortunately, reality is politics comes into play and it's not as straightforward. I mentioned earlier the COVID-19 situation right now in Malaysia is contributed quite a lot from migrant population and also from detainees in prisons. You know, typically these are not people you would vaccinate. Right, because you will target firstly healthcare providers, and secondly people of older age groups, and then thirdly with NCDs. Usually people in prisons are the younger population. Migrants are also younger population. Usually they're not with disease and they're pretty mobile. And in Malaysia we have a problem of illegal migrants as well. So that aside, going back to the earlier question, Dr. Fazila, I think there are many digital solutions that we should employ, and I hope the people responsible within MOH Malaysia is considering them to look so that we can deliver the vaccines efficiently and monitor any consequences or unintended effects efficiently. Because what we have not discussed really is about vaccine hesitancy, right? Which is a problem globally, not just in Malaysia. People who are anti-vaccines, and whether we can find digital solutions, in fact, to either manage that. Because we talk about digital and this vaccine hesitancy, it is the social media, it is the digital tools as well, which is making them easier to disseminate their misinformation. So digital tools have got a twin
can be good or bad.
can be good or bad, and it is assisting them. Just on the side track, I was listening earlier to your question to Dr. Engbol, and he was talking about privacy, data privacy.
And confidentiality.
I think for a lot of our digital solutions, some population are very hesitant because they think this is government watching, government monitoring our movements. Notwithstanding something is in the vaccine, right? To monitor our movements. So I think that aspect also is quite an interesting issue. That whether that how we address that is something that we never really thought about when it comes to digital solutions. So why I'm saying this, although I work in the NCD space, NCD also have got a lot of issues when it comes to use of non-proven therapies. People don't believe in conventional medicine. People are more likely to use unproven therapies, traditional, religious, whatever. It is very relevant, and it relates back to behavior. It relates back to trust. So one of the ways we're trying to manage this is firstly, we talk about co-creation. I earlier talked about co-creation. That means involving the very target population when we design the intervention. So basically, if you imagine, right, you're trying to develop a solution like telemedicine solution in the health clinics.
You have 1
if
minute.
yeah, all right. So yeah, involving the doctors there, the nurses there, while you are developing it and making sure it fits into their system, rather than saying that you fit around my solution, that's not good. So getting them and fitting your solution around their situation would be the better solution, better way to move forward. I'll stop there, Dr. Fazila.
It's interesting, Faisal, you mentioned a lot on behavior. So I think people issue is one of a big issue when we are talking about digital solution. I would like to go back to Dr. Eric Tayak. Dr. Eric, first of all, congratulations that you are chairing the new technical working group for e-health for ASEAN.
Thank you, Dr. Fasila.
So I was wondering, how can ASEAN and AHIN, perhaps two networks, work together, and how we can in this region, collaborate and work together in fighting this pandemic. To you,
Okay, the ASEAN TWG on eHealth will be among governments. And when we work with AHIN, eventually to make sure that digital solutions are in the forefront in our fight against the COVID-19 pandemic, then we would be united in purpose. This is very important, Dr. Vasila, because we have to be very united in purpose, and we welcome the framework presented to us by AHIM, Minding the Gaps, and we want to make sure that we can adopt this. For example, for the ASEAN eHealth TWG, look at it and set our priorities, and we have to lay down our plans, make sure that we can identify areas of cooperation among the member states, whereas we're coping differently, responding similarly, but we are mitigating impacts differently using different digital solutions. And maybe we can have standards as presented by AHIM, working with the Asian Development Bank
yeah.
and other entities as well, so that we would foster cooperation. Thank you,
Uh,
Dr. Vasila,
yeah.
for asking that.
Yeah, that'd be good. Actually, like mentioned by Faisal earlier, we are all in the same storm, but all in a different boat. So if we can all work together, I think we can fight this pandemic. That'll be great. Perhaps now I can open up also to my other General Council members if they have any questions. Dr. Alvin, Dr. Bunchai, to any of our panelists. Jai.
Hi, Dr. Fazila. Just wanted to congratulate the panel. Thank you for all of the inputs. And please feel free to let us know if you need resources from other countries. AHIN will help you make the connection. If you think there's something to learn from Malaysia, or there's something that you want to tap on the digital health, your counterpart in the digital health in Indonesia or the Philippines, we can make the arrangements and connect you to each other. But I think there's no school for this. All of you realize that the pandemic is here. I'm in charge of digital health, and there's no university that actually teaches this on a large scale as this.
Yeah,
I mean,
exactly.
all of you are in very challenging positions, and I think if you are able to help each other and connect to each other, you can say, well, Mr. Minister, this is how they do it in the Philippines. This is how they do it in Indonesia, and it helps strengthen your own case as well. Thank you.
Looks like Elvin, friends help friends helps here. Dr. Bunchai, you have anything to ask our panel?
Yeah, I think the issue about the vaccine is now coming into that, and the administered vaccine, the inventory of the vaccine, and the monitor of the vaccine, and or identify or certify who already have immune is very important. As the digital health technical advisory group in WHO, The group also recognize this, and they are working with the Department of the Digital Health and Innovation in WHO on about this smart vaccination or immunization certification. I just want to give you aware of this kind of the development that would help countries on this. Imagine that in next quarter, in third quarter or fourth quarter of this year, we're gonna start traveling, and how we gonna know who get what, and how each country can be interoperate their information about the vaccination. So this is one of the big issue that I think we have to think very hard on these two in terms of the cross border and also in countries. Over to you.
Thanks,
Fazila.
thanks, Dr. Bunchai. Jai, you have anything to ask or say?
Thanks, Fazila. I just wanted to ask if any of these countries are using any digital platform for administering the vaccination, like, for example, the registration of beneficiaries, the maintenance of cold chain, and then even post-vaccination to keep track of those who have been already vaccinated. Like, for example, India has got the COVID Vaccine Intelligence Network. So there is an app that's going to come up, and then does any one of the countries have already got started with this? Just wanted to know about it.
Jai, we have been just made aware of India's COVID. In fact, we have we'll be looking at it closely because we have developed our own information system. It's the Vaccine Information Management System. We have our own electronic immunization registry. We have to master list every eligible individual, screen them for using a criteria that allows us to evaluate, assess whether or not they should receive the vaccine, and they can provide the informed consent. We're using QR codes. We're looking at all systems, modules, linking it to the logistics and supply chain information system, and even to the adverse events following immunization. So very, very busy for the next several weeks before the vaccines are finally deployed in the country. Thank you.
That's great, Dr. Eric. Perhaps we can also hold a webinar if you can share with us later about this that's happening in Philippines. Ahin will hold a webinar, so that'll be good.
Thank you, Dr. Fasila. We welcome the invitation. We would most likely share what we have learned so far
on vaccine. I have a question here that came from participant for our panelists. If anyone can answer this, is there any open source tools available for the effective contact tracing which can be used in low income countries? Anyone would like to answer that?
My recommendation is to work it out with Google and Apple. You won't need to develop an application. And once this is introduced, it's between the government and Google and Apple. And if you have so many mobile phones out there, whether it's iOS or Android, then this is the best option for you. That's my recommendation. Thank you.
Okay, thank you, Dr. Eric. There's one more question here. I think this one perhaps anyone can answer, or even Alvin, Bunchai, or Jai. How are AHIN countries coordinating efforts to deal with the infodemic and dubious facts circulated by conspiracy theorists? It's an interesting question. Alvin, Bunchai, Jai, or any of our panelists?
Yeah.
And Dr. Iris Tan.
Each of our countries are already.
Yeah, sorry, go ahead, Alvin.
So there was a WHO course on the infodemic. So I think we gather some of the alumni there. Some of them were AHIN members, so we can gather them and give a feedback on the course, maybe one of the AHIN webinars. Thank you.
All right, great. And one more last question before we end this session. Do we have a universal digital software application for Asia to support updated statistical data on regional COVID-19 cases, mortality, and recoveries. Anyone?
I don't know, but we should have one. Thank you, Dr.
So
Fasila.
perhaps ASEAN and AHIN can work together on this
Yeah.
to
The ASEAN
develop.
that might be one of your projects will support you.
Yeah. Okay, I think we are coming to the end. It's almost 9 p.m. First of all, I would like to say thank you so much to all our panelists for such an interesting discussion. And I think we have learned a lot and we have also gained insights of some of the solutions, the challenges, and also some of the lessons learned. And we also had a lot of discussion on the vaccine. So I think the next few months, the focus will be more on vaccine. I think the contact tracing and so forth is already the last year's story. So this year's story is going to be vaccine. So perhaps as AHIN, we will also plan some webinars around vaccine in terms of digital solutions in a vaccine. So again, thank you very much to everyone. We will now head on to our next session. Our next session is also a country dialogue on the next set of countries. It will be moderated by our Dr. Bunchai, who is the chair of Asia eHealth Information Network. With that, thank you. Good night. Now I pass over to Dr. Bunchai. To you, Dr. Bunchai.
I think we're gonna have some kind of a break for about 1 or 2 minutes for everyone to kind of be ready for that. And let's break for 2 minutes. It is okay?
All right, sure.
Yeah,
2 minutes break for everyone.
2 minutes break, and
Grab a drink.
I'll start. And don't go anywhere. You will. Most of you have learned from the Wipro region. Now the zero region turn. Okay.
All right. 2 minutes.
Okay, 2 minutes.
Grab a drink and come back. Bye bye.
Yeah.